Bismillahirrahmanirrahim. Hadith of the day. The Prophet, peace be upon him, said, "Make things easy for the people and do not make it difficult for them, and make them come with glad tidings and do not repulse them." Assalamu alaikum, everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. My topic of presentation is hepatitis C. I'm presenting this topic under the kind supervision of my professor, Dr. Saira Afzal. Learning outlines, introduction of disease, epidemiological triad, mode of transmission, level of prevention, vaccination for Hep C, and recent updates, and then MCQs. Learning outcomes. At the end of this presentation, the participants will be able to describe the introduction of Hep C, epidemiological triad, mode of transmission, and levels of prevention from Hep C, along with recent updates. Introduction. Hepatitis C is contagious liver disease that results from infection with hepatitis C virus. It can range in severity from a mild illness lasting a few weeks to a serious lifelong illness. It is among the most common virus that infects the liver and has been shown to be major cause of parenterally transmitted hepatitis. Hepatitis C is the small enveloped positive sense single stranded RNA virus of the family flavivirus. The hepatitis C virus causes hepatitis C and some cancers such as liver cancer and lymphomas in humans. Problem statement. Every year, 3 to 4 million people are infected with hepatitis C. About 130 to 150 million people are chronically infected, or more than 5 lakh people die from hepatitis C. Based on CDC estimate, 2.5 million persons are living with active HCV infection corresponding to 1.0% HCV prevalence among the adult population in US. Pathophysiology of the disease. HCV is non-cytopathic virus that enters the liver cells and undergo replication simultaneously, causing cell necrosis by several mechanisms, including immune-mediated cytolysis, in addition to various other phenomena such as hepatic cytosis, oxidation stress, and insulin resistance. Epidemiological triad. In this picture, epidemiological triad is shown. Agent hepatitis C virus, environment, contaminated blood and other body fluids from the infected person, and host is almost all ages. Agent factors. Agent. Hepatitis C virus HCV is a spherical enveloped single stranded RNA virus belonging to the family flavivirus. Reservoir of infection. Man is the only reservoir of infection that can be spread either from carriers or cases. Infectious materials, contaminated blood is the main source of infection, although the virus has been found in body secretions such as saliva, vaginal secretions, semen of infected person. Hepatitis C is not transmitted through breast milk. Resistance in culture medium is found to survive 37 degrees centigrade and room temperature 25 plus minus 2 degrees centigrade for 2 and 16 days respectively. While the virus was relatively stable at 4 degrees centigrade without drastic loss of infectivity for at least 6 weeks, boiled or cooked food or liquids meant to be consumed for at least 1 minute at 185 degree Fahrenheit to kill the virus. Period of communicability. The virus is present in the blood during the incubation period for a month before jaundice and acute phase of disease. Host factors. Age. The highest prevalence of HCV infection is at age group 50 to 59. The outcomes of HCV infection are age dependent. High risk groups comprise the recipient of the blood transfusion, healthcare, laboratory personnel, homosexual, prostitutes, percutaneous drug abusers, recipient of the solid organ transplants, and the patient who are immunocompromised. Environmental factors. Cases present whole the year, all the seasons. Incubation period. The incubation period of hepatitis C is 2 weeks to 6 months. Incubation period of hepatitis A is 15 to 50 days, average is 28 days. Hepatitis B is 45 to 160 days, average is 120 days. Virus can survive outside the body for 7 days. Hepatitis C is 14 to 180 days, average is 45 days. Mode of transmission. The hepatitis C virus is the most commonly transmitted through exposure to infectious blood. This can occur through a receipt of contaminated blood transfusion, blood products, and organ transplants, injections given with contaminated syringes, needle stick injuries in healthcare setting, injection drug use, and being born to hepatitis C infected mother. Hepatitis C may be transmitted through sex with an infected person or sharing of the personal items contaminated with infectious blood, but these are less common. Hepatitis C is not spread through breast milk, food, or water, or by casual contact such as hugging, kissing, sharing food, or drink with an infected person. This picture shows the prevalence of hepatitis C, new infections, and then some of them there is spontaneous clearance of the viral load. In some people it leads to death, and in treated cases some may be reinfected. Stages of hepatitis C. The hepatitis C virus affects people in different ways and has several stages. Incubation period. This is the time between first exposure to start of disease. It can last from 14 to 80 days, but average is 45 days. Acute hepatitis. This is the short-term term illness that lasts for first to 6 months after the virus enters the body. After that, some people get rid of it and clear the virus from the body. Chronic hepatitis C. Most of the people that are infected by hepatitis C, up to 85% illness develop into long-lasting stage longer than 6 months. This is called chronic hepatitis C infection and can lead to serious health problems like liver cancer, cirrhosis. When the disease leads to inflammation that over time replaces healthy liver cells with scar tissue, it usually takes about 20 to 30 years to develop cirrhosis, though it can be faster in person who drinks alcohol or infected by HIV virus. Liver cancer. This ongoing infection causes inflammation in the liver. This extended inflammation can cause scarring called cirrhosis and ultimately lead to liver cancer. Chronic hepatitis C also increases the risk of non-Hodgkin lymphoma and head and neck cancer. Clinical features. Clinical features shows a loss of appetite, nausea, stomach pain, vomiting, dark urine, fever, fatigue, jaundice, and joint pain. Symptoms. Following initial infection, approximately 80% of people do not exhibit any symptom. Those people who are acutely symptomatic may exhibit fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, dark urine, gray-colored feces, joint pain, and jaundice. About 75 to 85% of newly infected persons develop chronic disease, and 60 to 70% of chronically infected people develop chronic liver disease. 5 to 20% develop cirrhosis, and 1 to 5% die from cirrhosis or liver cancer. In 25% of the liver cancer patients, the underlying cause is hepatitis C. The liver become more severely damaged, more obvious and serious symptoms called telltale sign can develop, such as yellowish appearance of the skin and eye sclera, that's called jaundice, swelling in legs, ankles, and feet caused by fluid accumulation, this is called edema, abdominal distension due to fluid accumulation called ascites. Diagnosis. The presence of antibodies against the hepatitis C virus indicate that person is or has been infected. The hepatitis C virus recombinant immunoblot assay, RIBA, and hepatitis C virus RNA testing are used to confirm the diagnosis. Diagnosis of the chronic infection is made when the antibodies to the hepatitis C virus are present in the blood for more than 6 months. Similar to acute infection, diagnosis is confirmed with an additional test. Specialized tests are often used to evaluate patients for liver disease, including cirrhosis and liver cancers. Anti-HCV antibodies are proteins your body makes when it finds the Hep C virus in your body. They're usually shown up 12 weeks after infection. Sorry, it usually takes a few days to weeks to get results. Though a rapid test available in some places, the result can be non-reactive or negative. That may mean you don't have Hep C. If you have been exposed in last 6 months, you will need to be retested. Reactive or positive, that means you have Hep C antibodies and you have been infected at some point. You will need another test to make sure. If your test is positive, you will go for the following tests. HCV RNA, it measures the number of viral RNA genetic material from hepatitis virus particles in your blood. That they usually show up 1 to 2 weeks after infection. The results can be negative if you don't have Hep C, positive if you currently have Hep C. LFTs, liver function tests. They measure proteins and enzymes level, which usually rise in 7 to 8 weeks after the infections. As the infected liver get damaged, enzymes leak into the bloodstream, but there could be normal enzyme level in Hep C infected person. This picture shows the chronic hepatitis C virus with time, LFTs, derangement of LFTs. Primary prevention. There is no vaccine for hepatitis C. The risk of infection can be reduced by avoiding unnecessary, unsafe injection, unsafe blood products, unsafe sharp waste collection and disposal, use illicit drug, and sharing of injection equipment. Unprotected sex with hepatitis C infected people and sharing of sharp personal items that may be contaminated with infected blood, tattoos, piercing, and acupuncture performed with contaminated equipment. CDC recommendation. CDC now recommends one-time hepatitis C testing for all adults 18 years and older and all pregnant women during pregnancy. CDC continue to recommend people with risk factors, including people who inject drugs, by tested regularly. Vaccination. Hepatitis C vaccine. A vaccine capable of protecting against the hepatitis C virus is not yet available, although vaccine exit for hepatitis C and B and development of an HCV vaccine has presented challenges. No vaccine is currently available, but several vaccines are under development. Secondary and tertiary prevention. Early diagnosis can prevent health problems that may result from infection and prevent transmission to family members and close contacts. Some countries recommend screening for people who may be risk of infection. These includes people who received blood products, organs before screening of hepatitis C virus was implemented, or where screening was not yet widespread. Current or former injecting drug user, even those who injected drugs once years ago, people on long-term hemodialysis, healthcare workers, people living with HIV, people with abnormal liver tests and liver disease, and infants born to infected mother. For people infected with hepatitis C virus, WHO recommends education and counseling on option for care and treatment, immunization with hepatitis A and B vaccine to prevent co-infection from these hepatitis virus, to protect their liver, early and appropriate medical management, including antiviral therapy if appropriate, and regular monitoring for early diagnosis and chronic liver disease. Treatment. There are 6 genotypes of hepatitis C and they respond differently to treatment. Careful screening is necessary before starting the treatment to determine the most appropriate approach for the patient. Combination antiviral therapy with interferon ribavirin has been mainstay of hepatitis C treatment. Interferon, PEG interferon, ribavirin are used to be the main treatment of hepatitis C. Hepatitis C is treated by using direct-acting antiviral DDA tablets. DDA tablets are safest and the most effective medicine for treating hepatitis C. They are highly effective at clearing the infection. In more than 90% of people, they can have side effects like fatigue, flu-like symptoms, anemia, skin rash, mild anxiety, depression, nausea, and diarrhea. Zipatire, this medicine, this is once daily pill, has cured disease as many as 97% of those treated. And Mevert, this daily pill offer a shorter treatment cycle of 8 weeks for adult patients with all types of HCV who don't have cirrhosis, who don't already been treated, and the treatment is no longer for those who are in different disease stages. The prescribed dosage for this medicine is 3 tablets daily. And Harvoni, this once daily pill cures the disease in most people in 8 to 12 weeks. Vikira this treatment is a combination of pills. 2 are taken once daily, 1 taken twice with meals. This treatment is taken 12 to 24 weeks. Nivi, this tablet is taken orally, possibly along with ribavirin. This and so Savaldi with elsewhere. This taken at same time every day with food. It may be taken with ribavirin and or interferon, or it may be taken for 12 to 24 weeks. Vertical program, hepatitis control program in Pakistan. Vision of this program is a hepatitis-free Punjab with 0 deaths caused by complication of hepatitis. Goals of this program is, the overall goal of this project is to reduce morbidity and mortality due to hepatitis B and C by working in all focus area defined in Hepatitis Act 2018. Robust surveillance in all health facilities, introduction of auto-disabled syringes, registration of barbers and beauty salons, mandatory screening of blood before blood transfusion, implementation of healthcare waste management in all health facilities, mandatory testing before dialysis, surgeries, and organ transplant, mandatory testing for prisons with 7 days of incarceration, compulsory hepatitis B vaccine of newborns within 24 hours. Achievement of hepatitis control program. The program has achieved following milestones. Implementing is for prolonged strategy of education, prevent, test, and treat. 2, macro elimination through hepatitis clinic and micro elimination door-to-door campaign. And 4, special initiative for universities, colleges, madrasas, prison, etc., and collaboration with private stakeholders. Now comes to recent updates. Here is the article published in International Journal of Epidemiology. Curbing the hepatitis C virus epidemic in Pakistan, the impact of scaling up treatment and prevention for achieving elimination. In this article, the WHO organization has developed a global health strategy to eliminate viral hepatitis. And in this article, they project with the treatment and prevention requirement to achieve the WHO HCV elimination target for reducing HCV incidence 80% and HCV related mortality by 65% by 2030 in Pakistan, which has the second largest HCV burden worldwide. And they made surveys among the people who inject drugs and blood donor data they collected. And current treatment coverage data came from the expert opinion and published report. The model projected the HCV burden, including incidence, prevalence, death through 2030. The estimated that the impact of wearing prevention, direct acting antiviral DDA treatment intervention necessary for achieving the WHO HCV elimination targets. And Conclusion of this article, this survey is substantial HCV prevention and treatment interventions are required to reach the WHO HCV elimination target in Pakistan, without which Pakistan HCV burden will be markedly. And mainly they are telling about DDA treatment for the prevention of Hep C. And other article is prevalence and risk factor associated with hepatitis B and C in Nawab Shah, Sindh, Pakistan. In this article, the overall prevalence of hepatitis B and C is shown that was 14.3% and 6.7% respectively. In bivariate analysis, hepatitis B infection was significantly associated with risk factors such as hospitalization, blood transfusion, needle injury, multiple sex partners and reused syringes, dental extraction, surgery, injectable drug abuse, and shaving at barbershop. And hepatitis C infection were associated with factors including surgeries, needle injury, blood transfusion, reuse syringes, dental extraction, and shaving at barbershops. The increasing prevalence of hepatitis B surface antigen and Hep C virus in Nawab Shah is public health concern. This dire need to implement prevention measures. And here is the main issue is the lack of education about the prevention in people of this area. Now coming to the MCQs, MCQ number 1 is, a person came to the medical OPD and diagnosed that he is suffering from hepatitis C and he had previous history of blood transfusion. The doctor told him that treatment drug will affect directly on the nucleic acid of hepatitis C virus. Which type of nucleic acid is present in hepatitis C virus? Option A is double stranded RNA. Option B is single stranded DNA. Option C is single stranded standard RNA. Option D is double stranded RNA. Option E is both DNA and RNA.
Charlie?
Yes, C option is correct. MCQs number 2 is child born in XYZ hospital delivered through C-section. His mother was a known case of Hep C. Now regarding the nutritional status of newborn, which among the following best way of feeding to protect him from infections and boost his immunity? Option A is formula milk. Option B, cow milk. Option C, bottle feeding. Option D, IV nutrition. And option E is breastfeeding.
Charlie?
Sorry. Yes, nahi. Option E, breastfeeding. As breastfeeding is safe in Hep C mother. As the hepatitis is not transmitted through breastfeeding. MCQs number 3. A known case of Hep C patient came to medical OPD for treatment. Physician prescribed him medicine that is to be taken orally with food. Which of the following medicine is taken with meals? Option A is the Zipatrier, B Harvoni, C Mefter, and option D is Elbaswire, and option E is Technivi. Answer is option D. MCQs number 4. A highly contagious infection that mostly leads to the chronic form and liver cirrhosis can be transmitted from one person to another through multiple ways. Which of the following is least likely route for transmission of Hep C virus? Option A, blood transfusion from an infected donor. Option B is birth from infected mother. Option C is dental surgery. Option D, sexual transmission. And option E is fecal-oral route.
E. Alpha.
Option E is correct. Fecal-oral route. Mr. Naeem is 45-year-old male who presented in medical OPD with yellowness of eyes, dark urine for the past 4 months. On investigation, LFTs were deranged. On antibodies testing, he was diagnosed as Hep C positive. Which among the following is the best pill for patients recently diagnosed, not having good compliance for medical intake? Option A is Zapater, B Harmony, C Mafter, D is the Elbeswire, and E is Technique. Answer is option A. MCQs number 6 is a person XYZ 50-year-old male who presented in medical OPD with pain, abdomen, dark urine for past 4 months. On investigation, LFTs were deranged. On antibody testing, he was diagnosed as Hep C positive. The safest and the most effective medicine is option A, DDA tablets, B is ribavirin, C is interferon, D is PEG interferon, and E is the ritonavir.
D.
Option A, DDA tablets, most safest and most effective. Liver is the largest solid organ in the body, about the size of a football. It is located mainly in the upper right quadrant of abdomen. Beneath the diaphragm, it is one of the vital organ in the body, which is an important function of liver, is affected by severe acute or chronic disease. Breakdown of RBCs, elimination of water and salt through the urine, synthesis of blood proteins. D is the synaptic neurotransmission, and E is digestion of protein in food, which is the important function of liver that is affected after acute or chronic disease. Answer is option C. Yes, option C, synthesis of blood proteins. MCQs number 8. A person is suffering from Wilson disease, a disease which involves abnormal copper handling by liver, resulting in copper accumulation in the body, is characterized by abnormalities of the basal ganglia of brain, splenomegaly, liver cirrhosis. Cirrhosis is most accurately diagnosed by option A is eye examination, B is blood test, C is liver biopsy, D is endoscopic ultrasound, E is LFTs.
Biopsy.
Yes, biopsy. C option. MCQs number 9 is hepatitis C virus is the cause of hepatitis C infection and some cancers such as liver cancer, lymphomas in humans. Hep C leads to cirrhosis and liver failure when left untreated. A telltale sign of liver disease is option A, hair loss, option B, increased urination, option C, insomnia, option D, jaundice, and option E, abdominal tenderness. What is telltale sign? Answer is option D, jaundice. MCQ number 10 is a recent increase in new HCV infection has primarily resulted from ongoing opioid epidemic associated with IV drug abuse. The disease exists short-term, acute, or long-term chronic form. How long the acute hepatitis lasts? Option A, 3 weeks, option B, 1 month, option C, less than 3 months, option D, less than 6 months, and option E, less than 1 year.
Alpha.
Option D, less than 6 months, acute. Chronic is more than 6 months, and acute is less than or up to 6 months. This is the key of MCQs. Reference of my presentation. YouTube link of our channel. Kindly like and subscribe, and thank you.
Thank you very much. Very nice presentation. And we know that hepatitis C, it is very prevalent in Pakistan. And whenever we talk about the hepatitis C, we always look for the prevention. And the primary prevention is for the newly infected person, so that they cannot transmit it to their contacts. It is very important, very much important to stop the transmission from the infected persons to all their contacts. And we also advocate the secondary prevention, and that is that once a person gets infected, he or she should be treated so that the further complications of hepatitis C can be prevented. And the third important thing is the tertiary prevention. Once the complications or the consequences of chronic hepatitis C viral infection has occurred, we have to further prevent it. We know that there is no vaccine that is available against hepatitis C, and the clinical trials are still going on the therapeutic effects of hepatitis C. And we are having no short-term prospect of introduction of any kind of vaccine in near future against hepatitis C. So the take-home message or the most important message that I want to give here is whenever there is any patient who has HCV must be tested for HIV. Second important message is that the mass screening is not desired because there is